Hello, welcome to Pediatric Neuropathology. A quick overview of embryogenesis so that you have a firm understanding as to where these pathologies are arising from. The brain tissue begins to differentiate from the ectoderm at approximately 3 weeks. Weeks 3 and 4, we have something called neurulation, in which we have formation and closure of the actual neural tube. The anterior, the rostral neural tube, the closure is within 24 days, approximately 1 month, the failure of which may result in anencephaly or encephalocele. We're in the rostral portion of the spine or the neural tube. If we get into posterior portion, we call this the caudal portion. This requires approximately 27 days. So this would be a little bit longer than the anterior, and of course failure of closure here then puts you into the category of spina bifidas, either the occulta, the meningocele, or the myelomeningocele, which then represents both the spinal cord and the meninges, which are then protruding out, and by doing so, the spinal cord being pulled out may then cause decreased ability to control one's bladder. Let's get into weeks 5 and 6. We have vesicle formation. By vesicle formation, prosencephalon, telencephalon, and diencephalon. The mesencephalon remains undivided at 5 to 6 weeks. The rhombencephalon, metencephalon, the myelencephalon is what it divides into. And then we have holoprosencephaly, which means failure of the prosencephalon for to then divide or to cleave. Now, when you say holoprosencephaly, you should be thinking about conditions such as trisomy 13, which is your Patau, or maybe fetal alcohol syndrome, where you do not divide your prosencephalon into telen and diencephalon. Weeks 5 and 6. These are clinically important. When you get into weeks 8 and 32, this is cellular proliferation and migration. So this is when the sulci, which means what? The actual, the crevice or the cavity between the gyri means the tissue, will be forming. We have a condition called lissencephaly. Lissencephaly means smooth cortical surface due to poor migration. Once again, remember, I want you to think about the outer aspect of the brain, the cortex. You should have the inner crevices or the sulci, and then you have the gyri, right? But what if you don't have the crevices and you don't have the partitions between the gyri? And then we call this a smooth cortical surface, which that's the pathology. We call that lissencephaly. Weeks 8 and 32 is where we are. And something called pachygyra, which is a large gyri, microgyri, small gyri, and then we have schizencephaly, which is cracked brain, cleft due to defective morphogenesis. Stroke is often responsible for this. So think of this as being, well, you know what schizophrenia is, which is broken mentality or cracked mentality. Think of this as being literally a cracked brain. Schizencephaly. Fascinating, isn't it?